Hey guys, Dr. Brandon Bupp back with you from Advanced Health and Wellness Center. Guys, many times we hear people talk about gut health or the brain-gut connection, gut-brain connection. We know that it's important. We know that our digestion, our digestive system is important. But we don't necessarily know why it goes bad in the first place. And so one of the absolute most common reasons that we see in our practice for poor gut health, remember, poor gut health leads to things like dementia and Alzheimer's, osteoporosis, arthritis, bad immune function. Bad immune function leads to autoimmune disorders and even cancers in the future. And so our gut health, we know, is super, super important. And one of the critical things that gets missed all the time is that the first thing that needs to happen is that we have to be able to break down our food. So our stomach has to produce enough acid in order to break down the food so that when it gets into the small intestine, it can actually be absorbed. And so the condition for weak stomach acid is called hypochlorhydria. Now, something that I want you guys to be aware of, I just read this study and it was really, really interesting to me. So the number 2 most prescribed drug in America is something called a PPI, proton pump inhibitor. Think of Prilosec, Nexium, omeprazole, things that actually neutralize or cause hypochlorhydria are these types of medications. They're prescribed because people have digestive problems, they have heartburn, sometimes they're prescribed for gastric ulcers, sometimes we hear hiatal hernias, people will get prescribed these medications. They're supposed to be used for a short period of time. The research says they should be used for a short period of time. And what we actually see is that people have been on these medications for years and years and years. So this study out of the Journal of American Medicine, American Medical Association, JAMA, said that increased use of PPIs over a long period of time increase the risk of hip fractures from 1.8 per thousand people to 4 per thousand, and that the longer somebody was on the medication, the more likely it was that they would have a hip fracture because it was actually weakening the bone. Guys, it doesn't make sense to decrease the strength of our stomach acid. That's not what's causing acid reflux. So what they found was if you took the medication, it would kind of push things through. It would give us an increase of motility speed, and so we would get the food down into the small intestine quicker. Well, what's actually happening is when somebody has low stomach acid, we're not digesting, the food's not getting digested as well as it should, and so it's literally rotting in your gut and giving off lactic acid or acid from the food decaying and organic juices, organic acids, and that is actually what's causing the acid reflux. But it's the fact of not being able to digest food as well as you should. So doing something that reduces our ability to make and create stomach acid only further increases the effects of the problem. So I want you guys to be aware of this issue. I want you guys to know that if somebody is having heartburn and problems with digestion, that we need to get to the root cause of why that's happening. We need to look at, we can test it in blood work, how they're producing stomach acid and whether that's having an effect on their digestive ability. Guys, figuring out that information is so important than just saying, hey, take this medicine and it's going to make you feel better. Because what we're finding out is just doing that and taking the medication is actually having a significant impact on our health. I don't want that for you. I don't want to let that happen to you. If you have any questions about what I'm talking about, please feel free to contact us. We'd be happy to have that conversation. We just want you guys to be healthy. We want you to have the information. So remember, if you have the knowledge, if you have the information, that leads to better choices, which leads to better actions, and that's what we're shooting for. Hope to see you soon.